Welcome to our video on dental insurance billing and coding. This video is designed to provide you with a comprehensive understanding of insurance policies and procedures, as well as communicating it effectively to patients. So let's get started. In the United States today, a large portion of the population has some type of dental insurance. It is estimated that only 55 to 60% of the people who have dental benefits in the United States ever visit a dentist in any given year. And that is a statistic from the ADA, the American Dental Association. Less than 5% of those who have a dental plan with a maximum of $1,000 per year actually receive that maximum per year. The average U.S. dental expenditure that an employer puts out per employee per year is only $160. The reason why it's so low is because people don't go to the dentist unless it hurts. As of October 1st, 2013, children have to be covered up to the age of 26. Therefore, our insurance premiums are going up, and the insurance companies have restructured insurance plans to pay for fewer services. The employer pays for the premium and buys the insurance, and the employer is responsible for the insurance coverage that a subscriber or an employee has. More expenses are shifted to the employee so that the insurance company and the employer can save money and reduce increased medical costs. Patients are paying higher deductibles and more out-of-pocket co-payments as a result. The better insurance plans still cover quality procedures, while the less expensive insurance plans will tend to pay for the least expensive service or procedure. We must face it that dental insurance is designed to increase access to dental care by reducing costs to patients. It is not designed to cover the entire cost. I use a word picture here for the patients to understand. It is similar to a scholarship is to college tuition. It is designed to help the student get a college education. It is not designed to pay the entire tuition. We must communicate effectively and efficiently to our patients. And in order to do this, we need to have some clear and concise policies in place regarding insurance billing, the patient's responsibility, and the dental practice's responsibilities. Before treatment begins, it is important that the patient knows and has a clear and concise understanding of their dental treatment, has an understanding of what their insurance company will pay, and has knowledge of what they are going to pay out of pocket, and then has any answers regarding treatment or insurance coverage answered. Here is a copy of a letter that can be given to the patient. The letter states that the patient knows that they are responsible for the entire balance regardless of insurance coverage, and then they will sign and date that at the bottom. This is in PDF form in your curriculum. And now there are 29 new codes for 2014. These are also in PDF form in your curriculum. Please review the handouts that are provided, and we also have the new insurance claim form for 2014. There have been two changes in the claim form. The first is box number 19, where we used to have the status of full-time student or part-time student. That has now been deleted, and it is going to be used in the future for something else. The next one is box 34. At one time we had this set aside for primary dentition when we charted missing teeth. It is now the section that we use for medical codes. It is necessary that all claims are completed accurately, so make sure that the first name is in the field for first name and the last name is in the field for last name. Submit promptly. Make sure that we submit these claims within 24 to 48 hours of the date of service. Also charge the proper fees on the insurance claim and charge the proper fees to the patient and collect the proper co-payments at the time of service. Then above all, play nicely when dealing with the insurance company. It is necessary to have a firm follow-up policy in place. So let's start with make sure to have proper and consistent telephone follow-up and systems. Also, make sure to watch the insurance aging report as well as the accounts receivable aging report. Make sure to monitor all adjustments through your software system. And in order to facilitate cash flow with dual insurance, treatment plan as if there is only one insurance and communicate that to the patient. Have the secondary insurance reimburse the subscriber or the patient directly. And make sure they know, as a courtesy, you will send in the secondary insurance. Now let's look at some final thoughts. When you think about it, how the office handles and bills dental insurance can be a first impression that the patient forms of the doctor and the practice. This can be a practice builder or a practice breaker. So let's make sure that we do this right in the first place. When working in a dental office, make sure to know the insurances that the doctor takes. Make sure to charge the proper fees and know the proper fees. And last but not least, make sure to know your computer system and the software defaults.